of what my involvement would be with the patients that come through our clinic. Again, they are reviewed with Dr. Turnbull, and we are often referred to see them, and we would do help in a respiratory assessment. And initial visits, they would come in and we'd ask them some clinical questions, discussing their effectiveness of their cough. Oftentimes they will say, I feel like there's something there, I just can't clear it. And I would actually have them do a cough for me, so we could sort of hear, yes, that would be, something that would move something or not. We would then do some measurements to get a baseline spirometry, as Dr. Turnbull talked about, and we use handheld simple spirometry that we would produce vital capacity. Definitely as a baseline, and as the patients come in for review, we would measure that vital capacity on subsequent visits. If their ability to take a big breath in and blow all the way out is approaching about 70%, and they are complaining of frequent pneumonias, inability to clear secretions, we would look at some techniques to help their own cough. So we just reviewed the steps of a normal cough or a productive cough. We take a big breath in, we fill ourselves all the way up. We have that, important little flap that covers our trachea, the epiglottis, and we develop power through our abdominal muscles to get secretions out. So as their respiratory muscles and, muscles of the body, weaken, their cough becomes less effective. So how can we help their own cough? And one technique that we have found a very inexpensive way to help support those steps of their own cough is using this is a lung volume recruitment kit, and it's available through Judel. And what it consists of is a disposable manual resuscitator and some one-way valves with a mouthpiece. And this helps the one step to cough and taking that big breath in. So we can put some more air in as their ability to take a big breath in decreases, we can add more air into their chest to help expand their lungs and give them a more productive cough. Say in the patients with bulbar involvement that they're not able to hold the mouthpiece very well, we can adapt the end with a face mask and try and deliver the air into the lungs with a face mask. Again, as the muscles become weak in this area, it does become more difficult, which I'll refer to the case study, to effectively fill their lungs, and the air oftentimes will go into the stomach. We can go on to another unit here. This is called the Cough Assist, and is produced by Emerson. And this, in conjunction, again, we would teach them assisted cough with this. And what this unit adds is actually it's a break for the patients and for the caregivers, because use of the bag with the assist can become exhausting for the patient over time. That they still have to produce their own peak cough flows to help clear the secretions. Where the Cough Assist, what this does, it does fill them up. There's an insufflation section where we will set a certain pressure to fill their lungs up more. But this machine has the added feature where if we swing it over this side, it has exsufflation pressure or negative pressure, which in combination with the abdominal thrust will produce the highest peak cough flows. Oftentimes you will see they say it can be done through a mouthpiece, but I don't find that as effective. We will apply it with a face mask. It does require perhaps a few more people to apply. If they have limb onset, it's hard for them to hold the mask on their face, but applying the mask and then timing it with abdominal thrust. And through our clinic, we do have 2 of these units available for loan to our patients in the community. You don't see these a lot in the community because they are not funded through Assistive Devices program. And if a person, if they are truly interested in it, if they wanted to purchase, it would be a purchase through their own means.